Thank you all again for attending tonight's meeting. This is the Region 4 SAC Healthy Community Meeting, as advertised on the hub site as well as the county website. First order of business is I'll give this to Ann and we can do our normal housekeeping.
Thank you, Eric. I'm going to ask about the previous meeting notes. I hope you all have had a chance to see them and read them. Do I hear a motion that we accept the previous meeting notes?
So moved. Second.
Okay. All in favor?
Aye.
Looks kind of unanimous. Okay, great. Similar to that, we need to approve the agenda. I think everybody has a copy or has seen the agenda. So anybody have questions or comments? Do I hear a motion that we approve the agenda tonight? Second. Okay. All in favor, say aye.
Aye.
Unanimous. That's it. And I thought you might want to introduce the speakers.
Yes, so thank you, Ann. Tonight we are going to have three different presenters. One is going to be from the health department, and the next one's going to be Department of Aging and Disabilities, and then finally Parks and Rec. And tonight we're going to discuss different aspects from park equity to health outcomes and specific needs for the aging population, and kind of just how it connects to land use. And then at the end, after all these presentations, we're going to do a group Q&A. So try to write down your questions, save them till the end, like we did last week, or last month. And then after the presentation, the Q&A, we're going to have a breakout group. And the breakout groups are going to go a little different than we did last time. We're going to do a group for the aging and healthy communities. We're going to do a group for parks and recreation. We'll talk about 20 minutes in those breakout groups, and then we're actually going to switch. So everyone's going to be able to have a discussion about both topics tonight. And then we're going to come back together and have a large group recap kind of thing. And then we have a couple public closing comments at the end that we can make when we get to that point. So without further ado, I will present the health department.
You want me to do my slides?
Yeah, whatever you prefer.
Perfect. Okay, great. So hi, everybody. My name is Jennifer Schneider. I'm the director for the Bureau of Disease Prevention and Management at the Anne Arundel County Department of Health. I don't know, should I just... Okay, just sit. Okay. I know my colleague Alexis was here last week to present for Region 2. So today we're going to be talking about Region 4, and I'm here today to show you how public health plays an important role in regional planning, and I hope to illustrate how public health works with other county agencies to create healthy communities. So public health includes both community, school, and environmental health. And the inclusion of public health in comprehensive planning ensures the required connections between land use and transportation, and then chronic disease prevention and safety. So the built environment can have a direct impact on public health issues, including water quality, adult and childhood obesity, inactivity, cancer, and respiratory problems. So just a really brief overview of the health department. So we were founded in 1930. We have an operating budget of about 80 million, and that has increased because of COVID. We have almost 900 employees, so that has also increased because of COVID. These employees consist of physicians, nurses, social workers. We have environmental health sanitarians, counselors, health educators, nutritionists, therapists, and other allied health and support personnel. So the department is responsible for improving the health of Anne Arundel County with a vision of a vibrant county with healthy people and healthy communities. The mission is to preserve, promote, and protect the health of all people who live, work, and play in Anne Arundel County. So critical to achieving this vision and mission is partnerships with the community, individual residents, the public sector, community-based organization, healthcare providers and insurers, academic institutions, businesses, and other private sector agencies. So we are held accountable for enforcing certain federal, state, and county laws, regulations, guidelines, and standards of care. So in addition to regulatory and enforcement work, we directly provide services, mandated, delegated, and locally initiated public health services. And we are broken up into 5 programmatic bureaus. The Bureau of Behavioral Health, the Bureau of Disease Prevention and Management, which is my bureau, Bureau of Environmental Health, Bureau of Family Health Services, and School Health and Support. So just to kind of show you where we're located, we're located all throughout the county. We are headquartered in Annapolis, at the Annapolis Health Center. We have, new to us is Bay Meadow Drive Health Center, which is in Glen Burnie. That is our hub for COVID services. That's a new building that we are renting this year, or for the past 2 years. So we also have buildings in other buildings in Annapolis, in Glen Burnie. We have behavioral health services in Glen Burnie and Annapolis. We have a Brooklyn Park Health Center. I know that's hard to see the small map, but we have the Glen Burnie Health Center, the Health Annex in Annapolis. Also new to us, we expanded services to the Lula G. Scott Community Center in Shadyside, because we know that there's not a lot of access to health services down in South County. We provide services at the Magathie Health Center, which is in Pasadena. North County Health Services Center, which houses some family health services and school health. We do work with both and provide services in both of the detention centers, the Parole Health Center in Annapolis. We also have a mobile unit that is currently, it's operational 4 days a week. We are down in Shadyside on Monday. Tuesday, we are in Glen Burnie, and then Annapolis, we're in Annapolis on Wednesdays and Thursdays. So that is probably newish. We also have staff in 125 public schools. We have staff in the court system, and then we have staff in the hospitals as well. So I was asked to provide some regional data today to show some health outcomes based on regions. So we're first gonna talk about median household income. So income is as a basic indicator of social class plays a dominant role in the maintenance of people's health. So the higher income is related to better health conditions and lower health risks, while lower income means more exposure to health risk factors and various adverse health outcomes, including shorter life expectancy, higher infant mortality rates, and higher death rates for the 14 leading causes of death. So as you can see here, Region 4 has a median household income ranging from $72,000 to almost $200,000. And so that is that, and you can see how that compares to other areas of the county. So then with green space, so urban green spaces such as parks and forests, streams and community gardens provides critical ecosystem services. Green space also promotes physical activity, psychological well-being, and the general public health of urban residents. So you can see where Region 4 is with the green space on the right there. And that can lead to the amount of green space also leads to, or can not having that can lead to health issues such as chronic medical conditions like heart disease, diabetes, and respiratory conditions. And then I have a slide later to show you how that is in Region 4. So walkability, and most of my slides do have to do with, I know, like food insecurity and chronic diseases. And so that's why we're highlighting these specific indicators. So walkability in a community motivates physical activity. And so that promotes health, improves health outcomes. And so in Region 4, the scores range from least walkable to, which is the all the way down the tip there to most walkable. So it's a very wide range in this region. So heart disease and diabetes, again, all those, walkability, green space, income, all relate to heart disease and diabetes rates. So in this region, there's a medium incidence of inpatient and emergency department encounters for cardiovascular disease and diabetes compared to the county at large. So as you see on the left, the cardiovascular disease rates, a very wide range, 19.5 to 131.5 per 10,000 residents. And then the diabetes is 15.1 to 53.8 per, that's supposed to be 10,000 population. So I apologize for that. So that's how this region compares to the rest, a little bit on the lighter side. So as far as food environment, I know this is an interest of this group. So lack of access to healthy foods contributes to higher levels of course, obesity in the county. 32% of adults over 18 years of age are obese in Anne Arundel County, and 12.5% of children and adolescents are obese. Lack of access to healthy foods contributes to diabetes, like I mentioned, and then heart disease, which is the #1 cause of death in Anne Arundel County. So as far as the food environment, the picture on the left, the map on the left is region 4. And if you blow it up, it shows you the percentage of households that use SNAP. So that would indicate lower income. So in this region, those families that are receiving SNAP benefits is the low and mid range. So it's between 0 and 10%. And then if you look at the map on the right, as far as low income census tracts that with low access to food. So that's when we're kind of talking about the food deserts. We are trying to get away from that term. There's mostly blue in West and North County.
Sorry.
That's okay.
So on the left map is lighter, less SNAP recipients.
Yes.
Darker.
Yes.
More
Yes.
SNAP recipients.
Yes. Yes,
So
sir.
Gibson Island has a lot of SNAP recipients compared to.
Like the dark green middle.
Yeah, that's a good question. I'd have to.
Like down by Greenberry Point. If, that's cycle very far.
That's a. What'd you say?
It looks like this island is the second lowest density, but the colors are.
Yeah.
Okay. Sorry.
No, that's okay. I know these are hard to see.
But you said you're trying to get away from desert.
Yeah, so
So
I can't remember what that is off the top of my head, but I can definitely let you know what that is. I know that our nutritionist, she's trying to get away, and I'm drawing a blank on what they're replacing it with right now. Yeah, I know. And I still use it, to be honest, too. Yeah. So this is like a new thing. Yes. But I've also, yeah. So, yep. So just creating healthy, just looking at specifically the food environment, so our challenges are physical access, so affordability of healthy foods, and then the built environment where we're looking at like grocery stores, sidewalks, bike lanes, and safe recreation spaces. So some things that can be done. So just, supporting any work around pedestrian bicycle paths, looking at enhancing streetscapes with greater sidewalk coverage and walkway connectivity, street crossing safety features, traffic calming, just making folks feel safe, safe to walk. We are really an advocate to promote Anne Arundel County Public Schools free and reduced price meal programs, including the summer meal programs that really offers a balanced meal and ensures that students do get a meal during the school and then in the summer when school is out. supporting farmers markets that accept SNAP and WIC benefits, promoting community gardens, and then creating a food policy council, or food coalition. And that is something that the county is working on. So we're excited about that. And the health department is represented, on that, council or on that work group. I think that might be it. Yep. And so that's all I have right now. So that if there's any questions. Yeah.
Thank you so
I'll
much.
try my best.
So we're going to hold questions
Oh, okay.
after all presentations, but just write them down. Don't forget them, and we'll be sure to get to them. So next we have the Department of Aging and Disabilities.
Hello, my name is Carissa Kelly, and I'm actually the director of the Department of Aging and Disabilities. I have some allergies, so red eyes and sore throat. No COVID. So Department of Aging and Disabilities, I hope you like the top slide, because this is this generation of senior. Individuals want to stay active. They want to be social. They want to stay in their communities with their friends, with their family. And actually, you know, older adults are living longer, than in previous generations. Who we serve. So we serve older adults, individuals with disabilities, family and professional caregivers, and really anyone interested in planning for their future, because it's better for the community to be able to serve proactively individuals before they become older adults, so that we don't serve them reactively later. So most people think we are senior centers. Senior centers are just one out of 24 programs at the Department of Aging and Disabilities. As you can see, we have 7 senior activity centers, soon to be 8 with the addition of the Severin Intergenerational Center. I won't go through all of the services, but I'd be happy to come out and talk to any civic groups, churches, organizations, and spread the word. To give you an idea of some of the services that we provide, we offer discount taxi coupons if you are an older adult or an individual with a disability. Our ombudsman monitor the nursing homes and large assisted livings within the area. They protect resident rights. We have a senior care program that helps individuals age in place through providing personal care, chore services, as well as case management. And we also operate 2 customer service centers, one on Ritchie Highway in Glen Burnie, and the other is on Riva Road down in Annapolis. And these customer service centers, you don't need to make an appointment. You can make an appointment, but basically you can walk right in and you don't have to wait for services. You can also call our number that is on the front of the directories that I had brought in. But that's 410-222-4257. You will get not options, but you'll get a live human being answering. Yeah. And you'll get transferred to someone who you can immediately start explaining your story. You know, for older adults, for unpaid family caregivers, and for individuals with disabilities, you know, there are a lot of barriers. We are not one. But many different programs. So the demographics, so 62% of older adults in the entire state of Maryland live among 5 counties. So yes, Anne Arundel County is a place where people, you know, would like to live their life and retire. And we're also, older adults are the fastest growing population, and that's not just a you know, trend for Anne Arundel County or Maryland, but that's a national trend. What do you, oh, I'm sorry, 60 and older is the metric that we used. I apologize. So within this region, of the 90,000 older adults that are 60 and older, this region has about 15,000. And I'm sorry, I don't know why the slide's doing that. So what do older adults want? And what is the mission of my department? The mission of my department is to help people age in place so that they can stay in their communities, in their homes for as long as possible, because it's significantly less expensive and it's where they want to be. Contrary to whatever, unless an older adult has a significant level of care, change, and we can't support them in their family home, or they don't have the natural support of a family caregiver. Nursing homes and large assisted livings are the last alternative. Your average nursing home fees run 100,000 plus. Your large assisted livings run approximately 80,000 plus. But another alternative that I would like to talk to you about, we have 108 small assisted livings. These are your community-based, they're in your residential areas, not in this region. The whole 108 is not in this region, but I would say a significant number we have in Pasadena, Arnold, some in Cape St. Clair, and these are your residential neighbors. These are your quietest neighbors. Whereas you could have a house in Pasadena like I do, where I've got a bunch of drivers and there's probably 5 cars in my driveway. These 4 to 16 bed facilities have maybe 1 car in their driveway because there's only 1 worker there with the individuals. It's significantly less expensive to be in a small assisted living, and it keeps these people in their communities. It keeps them in residential neighborhoods that look like where they lived all of their life, instead of going to an institution. So that's really what older adults want. They want to maximize their independence. They want to volunteer. They want to continue to give back to their community. And they do that with us helping meet those basic needs and putting services in place and, applying grants when needed, emergency funding. We have a menu of services at Anne Arundel County, and it's not all means tested. It's not all income based. Anyone can qualify for a service in my department. Again, civic engagement, social and civic engagement, and optimizing their physical and mental health and well-being. Some of the community outreach we typically do, we do the Lakeshore Rotary Club. We always go into Pasadena YMCA. We were just at National Night Out in Early Heights. And we do some regional veterans presentations. Our outreach isn't limited to these. I just highlighted a few. We'll go anywhere to talk about our services so that we can help spread the word. So the 2 senior centers that are located in this area are the Pasadena Senior Activity Center and the Arnold Senior Activity Center. So these are centers where members can come, be social, enjoy Anne Arundel Community College classes, attend fitness groups, art, special interest classes. And some we have fitness equipment and workout equipment. I know that we just expanded or we repurposed a room within the Pasadena Senior Activity Center with gym equipment because individuals like to come in, use the equipment and go if they're a member. Or they can stay and enjoy, an array of activities. The other senior activity center we have in Arnold, it's right over here, right behind the Safeway in Severna Park. And that is actually in, I'm sorry, did I said Arnold?
You said it's a rental.
Oh, it is in Arnold. I'm sorry. Yes. And that right now is currently a capital project. We're doing a 2,000 square foot expansion, and we're also doing a renovation on classrooms on the inside. We're going to expand to have a fitness center for individuals to enjoy, as well as the classes. We're currently working with the architectural and engineering firm who I think we just met our last meeting on August 9th. They're currently looking at the redesign, and they're going to submit a proposal for us. And we're looking at possibly beginning the construction July, August of 2023 on that. As far as nutrition, so we operate 21 nutrition sites throughout the county. Our senior activity centers also serve as a nutrition site where members can come in, get a hot meal. Sometimes we do special meals. We work with catering services. We work with local businesses. You know, in the pandemic, we had a restaurant initiative where we, you know, tried to rescue mom and pop restaurants using, you know, our CARES Act dollars and our ARP dollars. And it was a really win-win because we needed to serve older adults, and the restaurant, we had the money, you know, to be able to purchase meals. We even went as far as, I don't know, right up the road is the Donut Shack. And they were really a struggling business, you know, and, you know, we helped them out at that time. In Pasadena, we helped out Cookie's Kitchen. They were struggling and going under. So that was just a way to provide a good meal to older adults and help local businesses. So we have our home delivered meal program, and this is for individuals that are 60 and older that are homebound. So they're unable to get out of their house. So we partner, or not partner, we procure Meals on Wheels vendor, and it's delivered through volunteers to their door. And again, I talked about what we call our congregate meal sites. These are sometimes in your senior high rises. They are sometimes in senior activity centers, dependent on where the nutrition need is within the county. We also just finished up, we do it every year, our Senior Nutrition Farmers Market program, where we provide vouchers to use at the local farmers market. And I don't know why it says Piney Orchard on here, but it's the Severna Park, I think, over here that we have the farmers market coupons with. And then finally, at both of our senior activity centers, that I'm mentioning for this region, we have our Shop and Eat program. And individuals can come in and we rotate grocery stores and get a gift card, a $50 gift card for $25. And we rotate anywhere from Aldi's to Safeway to whatever regionally makes sense. Challenges. And these are not just challenges for the county. They're not just challenges for the state. They're national challenges in the field of aging and disabilities. The first is access to geriatric mental health services and facilities. To find a geriatrician who specializes in mental health, who understands co-occurring disorders, understands how a dementia may look a lot like a schizophrenia or another potential mental health disorder. You have to kind of travel up to Baltimore City. So, having more of those facilities available with willing geriatricians. Market rate housing and community-based assisted livings I talked about earlier. Again, these are those small residential, most of the time ranch homes that you find within your neighborhood. They are your quietest neighbors. And whereas you've got your $100,000 nursing home or your $80,000 assisted living, you have your mom and pop community-based that could, charge between $2,000 and, $3,500 a month, which is a lot different. And, if you look at your retired school teacher, they're getting a pension. Your retired police officer, they're getting a pension. But the only other thing they're living off is their Social Security income. And for an older adult, your income doesn't grow over time. And so sometimes these facilities really, we can negotiate with them as far as price point, and they're much more willing to work with those types of incomes. Transportation. this is everywhere. Providing transportation for older adults that is accessible, individuals with disabilities that's accessible, having safe, accessible sidewalks, crossable streets to encourage mobility. You know, if you're utilizing a motorized wheelchair and you can't drive, it's very important that you have sidewalks and curb cuts that make sense, that you're able to travel and it's not on the side of the road, that those curb cuts and that those sidewalks lead to grocery stores, lead to Walgreens and CVS to get your medication, because there's limited options out there. Some of the new initiatives in the past year and few months post our COVID response. During COVID, we worked very closely with the health department for older adults, as you couldn't really they had a hard time. We had a hard time initially navigating out the system that they used of the internet. So in about a month and a half, in a countywide effort, we established a warm line and we took over 17,000 phone calls for older adults. I was laughing with my health department counterpart that I saw her every Saturday morning, every Sunday morning for a month and a half. But now we're back to a time where we can start to do some newer initiatives. Looking where we're located in Anne Arundel County, situated by Fort Meade, situated by the Naval Academy, a lot of government workers in proximity to DC, and a lot of veterans. So we established our Veterans Coordination Center. This is, again, a number you can call. It's 222-3500. You'll get a live person. Actually, my executive assistant is the one who picks up the phone for that line. And you'll get a friendly person, and they'll be able to take a referral and link you to our partners in the community, which is Community Connection Services. Providing care and coordinated benefits for individuals that are veterans. We just launched our assistive technology loan program. So it's on our website. It's a catalog of resources for communication and mobility devices. It allows you to check out, much like a library, a piece of assistive technology, try it at home for 3 weeks. If you like it, if it helps make you more independent in what you do every day, we will work with you to make sure that we can find a grant to help you purchase your own equipment. Knowing that the two next languages in our county are Spanish and Korean, we just hired bilingual resource and housing navigators who are fluent in Korean and Spanish. These individuals are starting to, go into, into cultural communities and make connections where this fast growing population wasn't previously connected. So that's something that is new as of a couple of months ago. And then we do have our grief counseling program. We are looking to expand this into some mental health services. As I said, that was a need and a challenge. Individuals can receive one-on-one counseling from a certified grief counselor or participate in a group. And if we know for COVID, older adults have lost their spouses, have lost their friends, spent a significant amount of time without visitors to nursing homes and assisted livings. And so this is just a great way, to connect and rebuild our mental health and wellness. I talked about the expansion and renovation. This is, originally this was an old schoolhouse that was deeded over by a family to the county, has since morphed into a senior activity center. So it's, it's integral that we protect the historical portion of the building. So when I say expand, we're mindful of that. And thank you. And I guess I won't take any questions at this time because we're doing breakout rooms.
Thank you. And then last but not least, we have Bruce with Parks and Rec.
Thank you so much. Guess this is the hot seat tonight.
I guess so.
Okay. Oh, so, okay, good. Great, thank you. Thank you. Good evening. I'm Bruce Brucci. I'm the Chief of Capital Projects for the Department of Recreation and Parks. Thanks for having us here tonight. I'm also a resident of Region 4, so in full disclosure, I appreciate all of you and your efforts in working on this plan. Real quick, give you an overview of the Department of Recreation and Parks. Our mission at the department is to create opportunities to enjoy life, to explore nature, and to restore health and well-being. So it's that third point that has us here tonight to assist with developing plans for healthy communities. Real quick, an overview of the recreation and park system in the county, kind of by the numbers. Our system has over 12,800 acres of parkland. We have over 160 parks. It was 164 when I left work today. More than 200 trail miles and more than 1,700 park amenities. And when I use the phrase park amenity, an amenity can be a picnic shelter or a baseball field, a boat launch. Our parks are very popular. They were extremely popular during the height of the pandemic. They remain popular. We saw 2.1 million visitors just in the 8 months that ended in February of this year. Our trails last year got about 1.5 million users. Some of our specialized facilities, we welcomed over 300,000 swimmers at our 2 aquatic centers, over 100,000 golfers at our 2 golf courses, and over 30,000 skaters at our 2 outdoor ice rinks. Our recreation programs we offer around the county in elementary schools, in our own rec centers, in high schools, and all kinds of community facilities. Over 364 different recreation programs offered so far this year. More than 5,000 county residents have participated in those programs. Our recreation programs run the gamut. You can sign up for a program and learn anything from ceramics to self-defense at one of our programs. We have a huge youth and adult sports division. We obviously a lot more youth sports than adults, but the number of youth in this county involved in those sports is incredible. We ran 3 lacrosse tournaments earlier this summer in June, and we had 316 teams for those 3 tournaments. 316 lacrosse teams is between 5,000 and 6,000 kids. At one site in one day, we welcomed over 10,000 people, including the players, parents, officials, and other spectators. Right now, we're in the midst of well, actually just wrapping up 28 summer sports camps. One of the unique missions of the Department of Recreation and Parks in Anne Arundel County is we are responsible for operating school-aged childcare centers. We operate 46 centers around the county, averaging almost 2,700 kids a day. That's before school and after school care. And then selfishly about us at the department, there's almost 750 of us. Only about 150 of us are full-time. The others are seasonal or temporary workers. This year, our operating budget is $39.7 million. And County Council has blessed us with a record capital budget, a record investment in recreation and parks in Anne Arundel County of $99.7 million, which is almost a $50 million increase just over last year. I start with the numbers because I'm going to shift to talking about our land preservation, parks and recreation plan. This big book, which is available online, was just adopted by the County Council in July. It is the third of the major community planning documents in use in the county. Plan 2040 was adopted last year. The Green Infrastructure Plan adopted earlier this year. And now our LPPRP, as we call it. This plan is our 5-year master plan. It lays out the framework for what we're going to be doing, especially in terms of developing capital facilities to support our programs. And it is a three-step process, although it takes a year and a half to get through it. We start with measuring demand for our recreation and park services. That includes counting what we already have, an inventory of park amenities, a measure of land that we own. We compare ourselves against national standards for recreation areas, for number of baseball fields per thousand people, et cetera. We look at the population of the county and the age of the population in the county and where that is in relevance to where our parks are. Back to the numbers I was just talking about, we measure those sports program participation and park visitors. We review other plans, not just Plan 2040 and the GIP, but even the older, in some cases, 20-year-old small area plans. The most important part is public participation. We hosted 9 town hall meetings. We held an open online survey that attracted almost 3,000 people who gave us input on that. We like to listen to people, tell us what they want, what they see. Our tagline for this go round was, what do you want to see where you live and play? And that's what we ask people. After we've gathered all of that data, all of those numbers, we start the analysis to guide us in park planning. 2 key analyses that drive that. The first is a proximity analysis that has to do where parks are just relative to general population. And second analysis is an equity analysis. And I'll explain that in a little bit more detail here in a minute. Once we've done the measuring and counting and we've gone into the analysis, last step is for us to develop a plan to meet those needs. And I'll go through the plan as it impacts this region here in a minute. But we break our planning to meet those needs down into 3 types of projects. Acquisition projects where we need land. We don't have a place to accommodate whatever it is we're trying to build. Facility development, where we already own the lands, but we're looking to add new facilities on there. And lastly, facility rehabilitation, which is about taking care of the parks and facilities that we already have. Are we able to go to my next slide?
Yes, we were not be able to see the slide online, so I'm just trying to fix that. Sorry.
Okay, no problem.
You're going to advance the slides.
Can we?
It's going on.
There you go. Okay.
Thank you.
Let's talk about Region 4 and start looking at the first step, which was what are the needs, what are the demands here? Well, when we look at supply and inventory, folks, we're very blessed to live in this region. Almost, actually, more than a quarter of all the parks in Anne Arundel County are in Region 4. 44 county parks, 28 school parks, and half of our golf courses in this county are in Region 4. So that is not an issue. When we look at comparison to national standards, well, it's hard to have that many parks and not do pretty well in the national standards. Across the county, Anne Arundel County residents enjoy almost twice the recreational land of most communities our size in the United States. National standard is about 540 acres per thousand. We have over 1,000. We saw nothing in the older SACs to give us anything, point us in any directions that we weren't already going, either guided by our other analyses or by public input. And lastly, that public participation that I talked about, I pulled 8 things that were mentioned here specifically by people in these census tracts and people that participated in the town hall meetings for this part of the county. People asked for more fitness trails, more natural and green spaces, more pavilions and shade, more water access, including pools, more dog parks, which we get in every region in the county, more community gathering spaces, which goes hand in hand with the pavilions and then requests for shade. We saw an increase in number of people asking for adventure sports this year in this go around and especially in this region. And we've also had a lot of interest in community track and field, not at the high school. So those are the needs that we heard, what people were saying they wanted to see in this region. And I put a map up there. I think everybody's pretty much familiar with the region and our facilities. The blessing is that the longest trail in the county runs north to south within this region, the B&A Trail. And we are in the process of developing the Broadneck Peninsula Trail, which will cut across from the B&A Trail all the way to Sandy Point State Park. The only part we're missing is to develop a lakeshore trail or something that parallels Mountain Road out the Lakeshore Peninsula. The proximity analysis kind of bears out what those of us that live around here know. In the northern part of the county, we changed to a half-mile measure rather than a 5-mile measurement. In South County, we have to use a 5-mile standard because of the population density. From Annapolis and north, we changed to a half-mile radius around our facilities. The news is that if you're in this region, you are reasonably close. You are within 5 miles of just about every type of amenity that we own and operate. One of the true blessings being on this side of the county is you're extremely close to water access. For people that I talked to the other night in Maryland City and Laurel, they have to drive to get to the bay. We have it lapping at our doorsteps. So no issues when it comes to proximity analysis. When we look at the equity analysis is done using a tool developed by the University of Maryland, cleverly called the Maryland Park Equity Mapping Tool. And what it does is considers, I think it's 8 factors: income, linguistic isolation, walkability, access to public transit, the numbers of inhabitants that are under the age of 17 or over the age of 65. And it factors all of those into the computer model that starts with that proximity analysis where our parks and facilities are. And as you can see, when you look at the 2 peninsulas that make up Region 4, green is good, dark green is very good. Most of this region is dark green. So we don't have any equity issues within Region 4. Once we've done the analysis, we develop that plan to meet those needs. And this is the plan taken from the LPPRP for Region 4. Under acquisition, we own a lot of lands in this region already, but we're always looking for more land to build more things. And the number one thing we're looking for is water access. We don't have a boat ramp that opens onto the Magathie River. We would love to have one. We have studies underway looking at Beechwood Park off of Lower Magathie Bridge, and we have repeated studies looking at private and community-owned marinas. We will continue those efforts. We are desperate to find more water access, even in the eastern part of the county. I've listed there a couple of countywide needs. We're going to build an indoor tennis center. We're going to build at least one indoor sports facility. Think of an indoor soccer field. And we've had a lot of requests to build a water park. If you're familiar with the one down at Chesapeake Beach, any of those facilities could possibly end up in Region 4. They aren't a specific need of this region. Countywide, we're looking to add 500 acres of green space just for the purpose of being green. And so any of that area that we can add in this region, we're certainly looking at. The Department of Recreation and Parks each month looks at 6 to 12 properties that are either offered to us for free or bequeathed to us, or heaven help us that we identify and try and buy to add to that inventory. A lot of times those smaller parcels stay green. They're not big enough to turn into a park. but we are completely fine with leaving them as green open spaces. When we look at facility development, these are new facilities in places where we already have land. We're looking to expand parking at Bayhead Park. You see in parentheses that it says demand or proximity or equity. That's back to those analyses that I was talking about. The Broadneck Peninsula Trail is obviously a demand. If you'd see the results to that survey that I mentioned, that was going on pretty much in the thick of the pandemic. And the director joked that we were going to change our name to the Department of Recreation and Trails. The demand for trails and connectors to our trails is one of the greatest things we hear from the public. We're continuing to work on a number of improvements up at Fort Smallwood Park. This region has 4 of our large regional parks: Fort Smallwood, Downs, Lake Waterford, and Kinder Farm. We have a lot of things happening up at Fort Smallwood. We stabilized a bunch of the shoreline up there, and we rebuilt a swimming beach, just opened this summer. We have a new bathhouse and concession stand yet to come, and other improvements at Fort Smallwood. We're looking to make improvements and expand our Lakeshore Athletic Complex, the collection of multi-purpose and baseball fields there. Lake Waterford Park, I mentioned. Lake Waterford is the heart of our adaptive recreation program. So it ties into our efforts to address equity in serving the physically challenged members of our community. I mentioned the Lakeshore Trail. Obviously, that's a proximity need because there isn't a trail that serves the Mountain Road corridor. So people have told us they need a trail, and our analysis bears that out. Lake Waterford Park, I mentioned, in addition to the work on the land side, we do own the lake there. And so we're working on water quality. We're partnering with the Magothy River Association and DNR, and expect that we'll be doing a dredging project and some other water quality enhancements at Lake Waterford in the coming years. And lastly, on the Broadneck Peninsula, Spriggs Farm on the Magothy, where we are looking to stabilize the shoreline and preserve our water access there. Under facility rehabilitation, I mentioned ADA compliance. I'll speak more to that in a moment here if my voice holds out. A couple of other projects, facility irrigation projects, where we go back in, both lighting projects and facility irrigation projects. We're able to take an existing soccer field or multi-purpose field, and if we can change it to Bermuda turf, put irrigation in it, and even put up lights, we can expand the hours of use for that field, so the field is more available to host more teams. That we're looking at irrigation at Naga Vista Park. We've got lights going up at Bodkin, Lakeshore, and Broadneck. Part of what's driving the facility lighting is the change in the school calendar. Schools are going to go an hour later in the day. After school activities will end an hour later. So when those kids finally get to soccer practice, it's closer to the point where the sun is going down. So we're adding more lights to our facilities to help extend the use of that. And maintaining the shorelines that we have is important. We have too many parks that I like to say are getting smaller by the day. Spriggs Farm, I mentioned earlier. Jonas and Ann Catherine Green Park, we also need to work on the shoreline down there. That's a very exposed shoreline. Couple of current capital projects I wanted to mention. Up at Greenhaven Wharf in Pasadena, that facility is closed. It should reopen in about 2 weeks. We have rebuilt the wharf. We have added a new canoe and kayak launch. We've installed accessible fishing stations so that a person in a wheelchair can roll onto the wharf and go fishing. I mentioned some of the projects at Fort Smallwood Park, what we're doing up there. At Historic Hancock's Resolution, we're also looking to preserve the shoreline. That's one of those parks that's getting a little smaller each day. Downs Park, earlier this summer in celebration of the 40th anniversary of that park. We're happy to open the new amphitheater, and we're actually finishing that up this week. Beechwood Park, I mentioned, is being studied for additional water access, and phase 3 of the Broadneck Peninsula Trail is under construction. Real quick, I want to wrap up here, talk about equity, and when we talk about health communities, realizing that there are members of our community that don't enjoy all of that. Recreation parks have gotten behind. We were not good stewards. Some of our facilities were not as accessible as they should be. Kind of like the rest of our planning, it started with an assessment to tell us just what it was, how many problems we were encountering. We had over 3,000 individual barriers within our parks. That can be anything from missing curb cut to a bathroom door that doesn't swing wide enough. So we have a major effort. We have a standalone capital project that is funding these improvements. We are planning new improvements, and whenever we do renovations, we're adding more playground equipment, for example, that are accessible, putting in swings and merry-go-rounds that you can roll a wheelchair into. And we're expanding specific adaptive rec facilities. I mentioned Lake Waterford Park. In the next year, we'll be adding a power chair hockey rink there. We're building the county's second adaptive baseball softball field up in Brooklyn Heights. The first one is already at Lake Waterford, and we're partnering with the city of Annapolis on the adaptive boating center with Crab to get the physically challenged out on the water. And my next slide says questions, but we're not going to do that right now. So
Actually, we are. So if everyone's finished presenting, yeah, give a round of applause for everybody. So we have about 15 minutes. So any SAC member that has any questions for any of the presenters tonight, feel free to raise your hand. We can pass you a mic, and then we can get you some answers. So, Emma.
Hi, I'm sorry, I'm not the best at remembering names, but it was from the health department. I was just wondering, when you mentioned before you looked at like you said, income was one of the biggest determinants of whether or not someone, this is very simplified, is healthy. Are you also looking at that through an intersectional lens of like how other factors like race and other things? Okay.
Actually just thinking about one thing. Oh, sorry. I'm sorry. Yes, we are looking at it with different factors. We do look at race, ethnicity. We look at housing, and we look at education. Yes, we do look at that. I just didn't present that. Yes, thank you.
Walter.
Okay, Walter Ryder here. Thank you all. And I've got questions for everybody, but they all kind of come together. So, Jennifer, in your presentation, you kind of indicated that income and health are related. And you also threw up a slide that had walkability would be a good thing to help. And I noticed that your walkability crossed over Route 2, as if someone could walk across Route 2. And Corinta, that kind of ties in with some of the stuff that you said. You had also mentioned crossable streets and walkable. So the question for you two is, what can we do? Well, I have I want to know what you all are doing to kind of resolve that challenge. And then the follow-up is, what can we do to help you in that mission to try to improve that? And then I got a couple of more. So what are you all doing, and what can we do to help you in that walkability department?
Oh,
I can take it on an aging and disabilities perspective. So we're increasing our access to accessible vehicles within the county. We've got a proposed pilot project that's upcoming to work on resources that are more than just the paratransit, and as well as the accessible vans. But As far as individuals, we're trying to increase our transportation resources and people who have spent a lifetime as an older adult driving your own vehicle. It's trying to find resources for those individuals who are now relying on others for transportation, at least from our perspective. As far as walkability, you get into curb cuts, you get into things like that. That's Department of Public Works. And I know that every project that they're looking at right now, they're looking at the curb cuts, they're looking at making sure things as they're renewing and tearing up and rebuilding, that they're ensuring that it absolutely
So
meets all
you're relying
specs.
on Department of Public Works to do that, or do you have some outreach to them? to make
No, I'm
sure that
always in
happens?
contact with my colleague, and every sidewalk and curb cut that it's being worked on. I forget where we have some it's very recent. But they're doing curb cuts and sidewalks that meet the needs of county residents that have disabilities and are older adults.
Okay. And then also related to that, and it kind of goes over to Bruce. Bruce, you guys, you're doing a fantastic job. I use facilities all the time. And it's very impressive that we're all in Region 4 so close to things. And so, but with some of those facilities like Spriggs Farm, doesn't really look, isn't a lot of parking, isn't a lot of access for the folks that aren't really close. So what can we do as a group to help you push back on maybe some of the neighbors who may not want those wonderful resources opened up? What can we do to help out in that department? And that kind of goes to the equity issues that you talked about.
It does. And thank you for that. We encourage public participation. There are more people that want things than there are people generally that don't want them. We run into a lot of, well, if you read the Capitol, there's an editorial just last week from a NIMBY group out off of a creek in the Sherwood Forest area that we started studying, and
Valentine Creek.
that one. And of course this is the perfect year to attract the attention of the decision makers. And so they go out there and they convince the decision makers that this is a terrible place for a park. Water access is the greatest challenge because in my own community, you drive to the end of a narrow street and there's the creek or there's the Magathy, but there's no parking, there's no land, there's no way to get there. The city of Annapolis has their street end parks, which are kind of cute, where there's more places to park. That's a huge problem for us. That's our number one barrier on the water access is you have to go through communities to get to the water. So we ask for people's help. One, if you know somebody's got land for sale, or I heard Farmer Johnson's going to sell off 30 acres, or if your community association is struggling and can't maintain its marina or its beach or whatever, please reach out to us. I mean, we look for ways to partner with neighborhoods, with community organizations. We're the Parks Department. We're not coming in and bullying anybody. We just want to open it up.
No,
for
you guys,
more people.
you do a great job. You get that legitimate use in there. It's keeping it clean. But I do know where there's a private property sign right at the top of an entrance to open space land that the county owns. And I'm talking about Sullivan's Cove. I tell people where that is and they go, oh, I looked over there. It's private property. Why that sign is allowed to continue to be there, I have no idea.
It was interesting. The group that authored that letter that was in the Capitol, they put up signs along the roadway that said parking for Anne Arundel County citizens only. And Public Works didn't put those signs up, nor would we ever put signs like that up anywhere.
Well, there's,
I don't. You have that. So yeah, if you run into situations like that, and we do, we have people that will post no trespassing signs on our property. So that is an issue. And unfortunately, when we find out about it, we send our ranger staff out to investigate it, make sure it's ours, and see if we can abate, which is take down the signs.
okay. Well, I don't want to, I could go on.
That's
Thank
okay.
you very much.
Sure.
I just wanted to, this is not the question I was going to ask, but a friend of mine contacted the administration about the crossing in Arnold from one side of Route 2 to the other side, and mentioned that there is more infrastructure money now, because I used to be on the Arnold Preservation Council, and that was one of our projects to try to get a crossing that was safe. I just wanted to say it might be the time to look at that again. And what about Crownsville? That's the whole county, but that's a wonderful Crownsville. Who's going to be working on that and taking care of that? And how are you going to divide up what's happening over there?
I'm assuming you're asking about Crownsville Hospital Memorial Park. That falls to us for right now. $30 million of our capital budget this year is for the development of
okay, that
Crownsville
was the big-
Hospital Memorial
okay.
Park.
Okay.
What hasn't been decided is there are a number of buildings, and there are going to be a variety of county agencies. The county needs space for almost all of our agencies.
Oh, okay.
So there's still more discussion to come about that. The good thing is there is a bunch of open land out there, and we're going to be looking to develop that into some athletic fields. You're the second person to ask about crossing Route 2 in this LPPRP that I referenced earlier. There is a bridge across Route 2 to connect the Broadneck Peninsula Trail with the BNA Trail. That's in the medium to long term, meaning when we get a county council elected that is willing to spend $15 to $20 million to build a bridge across Route 2, that will become reality. Our interim plan is we are routing the next phase of the trail through Anne Arundel Community College and taking advantage of the signalized intersection at West Campus Drive. And so that will get us towards our goal of making it so that you can ride your bicycle from the airport to Sandy Point.
Don't forget Arnold. Somebody else have
Thank you. It's John Spencer. For all three of you, probably, I've been a walker for some time. And my observation looking around is there is not a lot of walking going on. It seems to be actually decreasing. And one of my pet peeves is when I drive by schools in the morning or the afternoon, you have the micro congestion where the parents are lined up dropping off or picking up their kids. What our educational system is doing is teaching kids not to walk. So is there any effort, several of you touched upon walking or the need for facility, and we have a formula, but I don't see the people walking anymore. I see them walking less.
Thank you. So I was just gonna say, have you noticed of an increase in that over the past, say, 2 or 3 years, or just? I was just gonna, so that was where, yeah, I know, I'm not trying to like blame it on COVID, but so that's what I was thinking too, just because of all, like, with the bus situations and there not being enough bus drivers. And then I know personally, my stepson, we drove him to school because, well, we live far away, but because we didn't want him on the bus with the social distancing and the masking, and we just felt like it was safer. So before that, so take COVID out of it. Okay. So that's a good point. I think that from a health standpoint, our school nurses in the schools maybe they could, no, yeah, no, but I mean, yeah. Yeah. Yeah, I know. That's going to be a hard.
Your kids off before COVID?
Well, I'm in a little different situation.
We all
Yes,
are.
yes, we did. Yes, we did. Yeah.
I'm sorry, I adopted my granddaughter 5 years ago, 4 years ago, whatever, brought her from San Antonio in November, and I made her walk a mile to high school. My friend, I can't tell you how many people criticized me for making her walk, a whole mile.
Mm-hmm.
I'm sorry, I just think that's plain wrong.
Mm-hmm. But I mean, that's a good point to focus on that, to encourage that on the school level. I think it might be more of an education, of course, like for parents, like that's going to be a hard sell. Yeah. Yeah.
And I'll add to that, when I talk about our trails, we talk about trails and connectors, and while the B&A Trail and the Broadneck Peninsula Trail are major trails, we also have plans for connectors. On the Broadneck Trail, for example, there is a spur that's going to go to Broadneck Elementary School. There's a spur that goes to Belvedere Elementary School. So we're trying to tie those together. Just this afternoon, I worked on a planning document for Phase 4 of the WB&A Trail that is going to go from Wall Chapel Elementary School through Arundel, through the Arundel High School, Arundel Middle School complex, and connect with South Shore Trail. So we are looking at making those kinds of community connections all over the place.
Right. Well, I understand trails are, to me, recreational. And a lot of people argue that the solution to transportation congestion is mass transit, which nobody's going to ride. And that's my background. Nor are people going to really ride bikes to work. I challenge anyone to show me more than 3 people in Anne Arundel County. In fact, 1 person that rides their bike to work and is taking traffic off of Ritchie Highway or Maryland 3. It's just, I'm sorry it's not happening, but Walter has a different duty, right? Where do we go? From Serrano Park? Okay, that's 1. Very good.
And I get so much pushback from my people. To not do it.
Not like when it rains.
Don't ride.
But what about you ride on a rainy day or a snowy day? Wow, you are. I'm proud of you. Gold star. That's great. I used to walk to work, and I worked in DC down Long Pond Plaza. I took the commuter train in to Union Station. I walked the mile and a quarter every day. And it took me 22, 23 minutes. I knew because I missed the train a lot. But anyway, in the evening, no matter how upset I was, by the time I got up Capitol Hill Union Station, I calmed down. So, I mean, I think I'm a believer in it. I think it's fantastic. It does a lot for managing anxiety. I wish we had seen more of it during COVID. It's great craziness, but I just see the overall trend going down. And my background's transportation, sorry. Federal highway statistics show that in 2022 now, our traffic volume is higher than it was in 2019 before all this. It went down 10%, or 11%, came back 10%, 1%, and now it's 0.55% higher.
I will say, as a parent, that is the only thing that we had to do with our kids during COVID. I think we went to a different park every single day. We even went out of the county to see new parks, and so I think that was parents, though there may not be the functional walking to school, as a parent, just, the day before yesterday, I took my kids up to Fort McHenry, and so we take the kids so that we know they're safe and, do the walking in the park that way. So.
Right. Well, for the senior program, when you're training kids not to walk, by the time they get to be seniors,
Sure.
then you have even more disabilities.
Yeah, for us, where I live in a peninsula area, I'm not sending my kids down Mountain Road.
Okay. Thank you for letting
That's
me
a
know.
dangerous road.
So I saw 2 more hands, and then we can take a quick break. Steve and then Michael.
Yeah, Bruce, Steve Miller. I don't think the county has a better plan than the one that your department has produced, because it not only laid out a vision, but it put a budget behind it, and it put a 15-year CIP behind it. It is so great to see that amount of diligence, to even include putting in the organizational chart and describing what everybody does within the organization. So who's actually going to be doing the things that are there within that plan. So as you laid out all the different things that you have planned right now for Region 4, how much influence do you expect that we will be able to have as a group? It may be rearranging some of the priorities that you have for some of those projects with the timelines that you've set out. And I don't mean this as a criticism, because I'm a relatively new member here within Anne Arundel County, but it's taken forever for the Broadneck Trail Phase 3 to get started. And that sign, I hope, doesn't count as groundbreaking yet, that was put up there here recently by the community college. So there is just a little bit of skepticism when you have 150 people, you know, that are doing such yeoman's work, that we can actually execute this on the timelines that we'd like to see these things happen.
Thank you for your comments on the LPPRP to begin with, but we are, we have a lot on our plate right now, and we're trying to add people. We work with, and Chris mentioned earlier that Department of Public Works is responsible for building everything in Anne Arundel County except schools, police stations, libraries, senior centers, parks are all built by the Department of Public Works. So our agencies are the owners, and we drive those programs. We develop the Broadneck Peninsula Trail. We turn it over to Public Works to secure an engineer who then we work with, and then they secure a contractor who, by the way, put survey flagging just this side of Baydale Drive today. So that work is underway beyond the sign that you see posted. And look for real dirt to fly there in the coming 2 or 3 weeks. Our needs are for people to be involved, and I tried to show you. I mean, nobody within Rec and Park said, "Hey, let's go build a water park." You know, we're trying to keep up with the daily crush, but when we go out to the public, in meeting after meeting, in the survey results, people are really interested. Why don't we have a lazy river? Why don't we have a splash pad that we can go to? So water park is now on our list of priorities. We are actively looking for a site. So it doesn't even have to be a group of people. It can be one person who comes forward with an idea and says, you know, I think this would work. And you start kicking it around. Other people hear about it. I point to pickleball as the example that nobody heard about maybe 10 years ago. Now it's on ESPN every Sunday afternoon, the fastest growing sport in the country. We can't keep up with how many pickleball courts we have because our maintenance people are going out and we're overstriping tennis courts to make up for the demand we're hearing from people for more pickleball courts. So we went from 21 pickleball courts 4 years ago to 67 pickleball courts today. And I've got a feeling that the paint's not dry on at least 2 others. So that is always growing. And that's how things start at the grassroots.
Michael, you had a question?
Yeah, I'll try to. Couple questions. One, just a curiosity question about the senior centers. What's the average square footage, and is it like a library where anyone that lives in the county can be a member of, can come to the community?
Yeah, so in order to be a member of a senior center, you have to be 55 and older. Once you're a member at one center, you can use any center. The square footage really is dependent on, the growth in that area. The reason for expanding right now in South County, we're doing a 2,000 square foot renovation and an expansion because we saw a growing population of older adults and our membership was just growing day by day. Arnold was the next one that was identified, and we look at our metrics and, that, region was growing day by day. Pasadena Senior Activity Center is currently in Lakeshore Plaza. So I'm really looking at that as, either the next capital request or doing some feasibility as it borders a restaurant with shared parking. So you literally, as an older adult, it's difficult to park there. And it doesn't provide any outdoor or recreational. And I'm sorry, what was the second?
So what's the square footage of Arnold? I know you're expanding 2,000 square feet.
Oh my gosh, I don't have that with me. I'm sorry.
That's fine.
I actually could pull it up on my computer momentarily though, because I have a list of them. Yeah, I don't know.
No worries. And second question, we talk about the county's population is aging, and I think I read somewhere the older population is increasing at a higher rate than the younger population. Yet I think we're seeing a lot of turnover in communities. You see homes sell, and usually it's a younger family moving in. And where are those, I guess, where are they going to? Because we're seeing turnover in a lot of communities. And we talked earlier about creating these small assisted living communities within residences. I'm trying to find, like, how many, what's the shortage? I mean, they're going out, we're seeing turnover in communities, but it's like, where are these, where are they moving to? Where are they going to? I'm trying to.
What do you mean? So the assisted living, they're not assisted living communities. So I actually have one of these small community-based assisted livings in my neighborhood. So it's a small 4-bedroom house. It has 4 individuals there. The person that owns it typically runs it, maybe another staff, you know, who are there. And again, there's 108 higher concentrations of, you know, these facilities are, you know, in Glen Burnie, Pasadena, Annapolis, as areas where there's growth. We're always looking at our census and our 45 to 55 population and where older adults are. And again, we have a lot of those facilities up in Glen Burnie and Pasadena because we have a lot of older adults in that area. And then, you know, if you know, they're, you know, living independently in their home, again, we keep them in their home as long as possible. But the alternative was what I'm saying is a small community-based assisted living when that level of care does change.
Just following,
Sorry.
Do you offer to keep them in place? The other like grants to help retrofit the homes to make it more ADA acceptable?
Everybody's need that walks through my door is different on how they can age in place. For my own family, right now, they live over in the tenured communities and bordering Pasadena and Glen Burnie. You know, and for my family, in order to not have to go to the nursing home, we needed to get a hospital bed. We needed to get, you know, adaptive commode and shower chair. For others, it may be putting, you know, respite care in, putting personal care assistance in. And we have a program that is a very low cost respite care provider. We have respite care grants. So, I mean, anything and everything that we can do, and it's really not prescriptive because, you know, my needs to age in place are going to be different than yours, dependent on our personal circumstances or dependent on our mobility needs and things like that. So it really is the person tells their story and we help piece everything together to help them stay in their home.
Any more questions from the SAC? If seeing none, we're going to take a quick 5-minute break. So if you guys just want to go use restroom, get a drink of water, and then come back, we can move on to the next step of the meeting. So, and thank you to the presenters again.
Tell me your route. How do you get to Crofton? You're going down 3?
I was just wondering, I like the you mentioned about the do you have any programs that like I think I would have to pay for
There's a small, but.
I'm watching. And I'm just wondering, maybe like, would you have any program that like, yeah, it's. I'll share it.
For those people.
Yeah. Right.
That certification.
Low access on there. Yeah.
So I'll take the.
Thank you.
Sleep in the same way.
Okay, yeah, right.
I know that's wonderful. I started doing that.
There's, good visibility. Yes. Never.
Yeah, I don't know. Certainly when I'm out here.
I was gonna say.
You can almost see it as soon as you go into it. I mean, it's like last night. I ride my bike at center. Like my daddy and the walk. And I was taking all of this, like, total numbers of people. This car is less than 40,000. I mean, are not walking. But the point is, it's really, we have, times, it's a way of recreation. Well, it's not well. There are other than yeah.
Well, that is, as John. I don't see it.
Yeah.
So I don't know. I would think.
If somebody else told me.
A long day. And it's the volume.
No, I have allergies, like my.
Go on our website.
What do you want to do with this?
So is this one the one that's yours?
I think it's the same.
Okay,
I mean, I don't think it matters. I'll put this.
yeah, sounds good.
Never get it. Especially in a high volume.
No, I'm right.
I never read the label.
Yeah.
All right, everybody, if you guys want to take your seats, we can kind of just kind of wrap up the evening a little bit. So we are going to continue on with the meeting, and the next thing we're going to do is we're going to do a breakout session. So this breakout session is essentially just going to be one big discussion now because we're running a little short on time, and there's several of us missing tonight anyway. So if we just have one general discussion, I think we can accomplish the same thing we were hoping to accomplish in breakout groups. And what we're hoping to accomplish in breakout groups is similar to what we've done in the past. Everything we've heard tonight from the concerns of accessibility to healthy foods, to the great parks in the region, what can the region plan do to help either accomplish goals and objectives set forth in Plan 2040, or what are some other goals and objectives that the region plan in Region 4 specifically may benefit from moving forward. So with that being said, as a group, we're gonna work for about 15 minutes, just kind of a group discussion, and write up our thoughts, and we can continue from there. So to kind of start this off, I'm gonna put down the mic. So I don't know how the Zoom is gonna hear this or not, but essentially what we're gonna do, just based on what you heard tonight, what are some of your initial thoughts? What are some ideas that you initially thought of as it relates to Region 4? Anybody feel free. Yeah, absolutely.
Sounds like you're trying to do that.
Well, my issue is walkability in general, and not just trails. When I look at trails, I think of recreation. I think of commutation and traffic congestion. One of the number one priorities. Highway traffic is up. You said the state is down. It's more level. Still more traffic. Start looking around. It argues about how can we possibly have more travel after 3 years of all this telecommuting that's supposed to reduce our traffic. I mean, how does that make sense? They can't explain it other than people maybe are not working out, is taking trips.
So it's not surprising that a lot of people don't walk if they were not used to walk before, right? I consider myself lucky. I live within a short walk to my elementary school, junior high, high school. I didn't own a car until I was 19, and I didn't have to. A lot of people don't live that close, and sometimes maybe it's not comparable with having to. Maybe it's close by, but you know, I was at a public meeting not long ago with Eric, and somebody was saying how going to school they had to go by a roadway that didn't have a very good sidewalk with car speeding. So maybe it's not just the proximity, but the design, the roadway to get there, or the path, or whatever. Comfort is being looked at as a big thing in how to design things better. So if you have any ideas about things that make you walk more, bike more, because improving the connections make people do it more, not less. So, right. No.
Just that, I guess before, but the access resources sometimes prescribed. Sidewalks, the trail, and then you'll go like over and then out that. Just where I live, I think down there, where they have entirely I'm trying to decide, there aren't sidewalks that anywhere in that, it's not like that. And that's, and I mean, especially when on the road, cars, speed down all the time, and they only use the numbers. So it's like, if you don't create that, that expectation that you can be able to walk in. So I agree that it's not only the road, but sidewalks, urban areas, in places where there's a high especially if we consider that where families are, it's a bit small. I also think in addition to sidewalks, but traffic goes so fast around here. I grew up in Boston, which has crazy traffic, and I was scared of my kids wanting to drive here. It just seems crazy. Like, yeah. But then if you put curb cuts crosswalk on the Route 2, it's still not gonna feel very safe.
Oh, and I think a lot of roads are kind of windy and especially in major four, right? There are a lot of turns and the topography as well. I know that driving around. So
Sorry, someone from the last session, I don't know who it was, but they definitely are gonna be goes like on the highway where it goes to a third and then I think it goes back to two. So they were gonna move so that will be perfect.
Well, one thing to think about.
No, I'm just gonna say, that Anne Arundel is suburban county. If you look, and the way I design the county, I was laying it out, is you push the higher density over to West County because you have tremendous transportation corridor around highways, rail, buses are all over there. And so that's where the density should be. The problem gets to be where we are kind of mixed. South County is rural. So we never hardly ever expect to see sidewalks there. So we're kind of in an evolving situation where in the suburban area here, in this region 4, we're evolving toward urbanization. We're having more infill. I certainly my own neighborhood, I've seen a number of houses. And I've been a kind of advocate right off all highway. Finally, I saw last week, surveyors are out there, going to put a sidewalk all the way down at 3 schools. So that's good thing to say that's happening. But it took people like me and others to go to meetings after meetings. And I think, Walter, you've been advocates for bikeways, whatever, like John Foran, some of the others, it pays to speak out these reasons. But what I would urge is we have a sidewalk prioritization where sidewalks be located at schools, senior centers, things like that. There's a third thing I have in my mind. School, senior centers, shopping, medical.
So one thing to keep in mind too is we talk about resources, the different accessibility, different modes of transit, which is, I don't think anybody here disagrees with that. I think one important thing to think about is where are people going, right? Why are they using? Why do they need? So think about your community. Think about what you do, like your commutes. How do you get to work? How do you get to school? How do you talk about the kids that gets at science class or at school? Or when you go to get promotions, you want to talk about the public health component. How is the access, in your opinion, to healthy foods, healthy other than what can region board do health standpoint, health with that? I think we touched on some of that here. Is there more of a discussion related to health? Moving forward.
I don't want to tell someone they're not allowed to have a car. They're legally allowed to have a car, but we need to come up with initiatives, policies that help encourage it. So if you don't need a car, encourage them to find it. I don't know if my region before it's with cars. And that but by partially out there are no sidewalks. That's fine. Yeah, I don't know exactly. But I just suppose that I think that the surge
do people like, how, think about your commute to approach, is it a 5-minute drive? 10-minute drive, half an hour? And do you like how long it takes? I think that's a question. I know there's certain areas of the region, specifically coming down southern portion of the region, where there's a lot of single family, and that's what it is, right? I mean, it's very difficult to really add much today, right? It's very difficult. But so those people may have to drive.
I live there.
Exactly.
There's nowhere I want to go.
How long does it take to get to the Walmart park?
I mean, it's not bad if I go on it, but you know, driving it out to do it, you know, even if I get Target on that. Yeah, I don't know. I would say with another thing in that I can wash through the safe way. Like trail, like neighborhoods. But the only thing is, I can bring to the grocery back. And let them weather. And biking, the same thing. I just get, I didn't go not that often. So that's just something.
Eric, I'm just trying to, and these are all the great ideas, but Bruce just laid out. I mean, he did better than anyone has so far of going through these before and making them relevant. I don't have to think a whole lot more than what he planned. The only thing that I asked him, that I would ask again in Bruce, is that are their priorities and their timeline. You know, as it pertains to us, are we going to help essentially massage what he's got there already? And it's from input from, you know, people who live here. Is that what we're really going to do? Or are we going to pile on more?
Well, so, I mean, that's a question for the group, and I think one thing we discussed is what are some, because I agree with you, I think the Parks LPPLP is basically the Parks Department is on. What are some of your favorite aspects, in your opinion, the best aspects of that plan? What they're doing, how can we make sure that actually comes to fruition rather than just stay on paper? And I don't think necessarily the parks is that kind of plan by any means, but rather being safe and sorry, what can we do to really help make sure those goal points become actuality?
So I'll take my point then. It is, I put Rodney right away. Getting that fleet, and I would even toss in potentially that bridge cost. That when Bruce said $15 to $20 million 2 years ago, it was 10 million, and people thought that was it only gets more expensive because the Broadneck Trail, I think, started off maybe with $1.5 million. 1999. Okay. So the point is a group has to shape, you know, the priorities and everything, and that's what things need to be done. And because I routinely we got out of our way almost every day. Today, just on that one site that we completed the Broadneck Trail, which runs between two shopping centers. I saw people carrying bags after they left. I saw a guy on a motorized wheelchair. I saw kids unsupervised with their parents, without their parents, riding a bicycle safely on the trail. It's a connector. And so it's such a joke. And it's a connector to a larger trail, the DNA. But my point is, there's a list of things up there right now. I just want to know if where we sit down and start doing work, are we going to go through those kind of priorities and try and say this is what we do?
Absolutely, and I think that's something you, as part of the background material, we only give you limited amount of resources. We could do master plan. That's hundreds and hundreds of pages. So what we hope to accomplish as SAC, you all are a very diverse group. You all have your own differences, and we understand what you guys hope to accomplish, maybe different. And where your passions lie, we hope that you do a little research. And that means digging into certain action plans that we don't necessarily talk about or talk too much about. When we in the next couple months talk about the goals and policy strategies, Lorenzo just say some more feedback, surveys. We want to send that to you and have this discussion. Did we hear you correctly? Is this where your passions lie? And when if the answer is yes, great. If it's no, what do we miss? What should we change? And that's where we rely on each of you all to do your homework, to do your digging. Because as you all know, and as I've said multiple times, each one of these meetings, each one of these topics can go much longer than 2 hours. You know, maybe some of them, but a lot of them can go in for these are professionals that devote their life to this work, right? So we understand there's much more information out there. So when we bring you guys together, we want you to tell us what you are passionate about, so we can get what you want into this plan. So at the end of the day, this is a public plan. This is for the community. This is for Region 4. This isn't for Eric, Lorenzo, and Jesse. It's not for Steve. It's for Region 4. So that's why we really need you all to really, if you're passionate about something, I can't emphasize enough. Get into those master plans. Find what really hits home with you, and let us know about it. So when we submit this, when we submit Region 4 plan to PAV Council, you all are part of that plan, and you are standing right beside us, supporting that. And hopefully, a lot of them with county council members say, "Hey, this is a good plan. We did this. It's good." So that's what we're trying.
Can I talk real quick to that? Be specific to places and roadways and things that you heard tonight, but you can add to. So for example, I didn't hear, the alternative would be the lake shore. Parts and Rec, we heard from them that they have identified the DNA trail, the Brockneck, but Lake Shore doesn't have a clean alternative. So I would like to hear, some proposals for that, so we can put that right after thinking of it.
Steve touched on the key concept, cost. Nowhere do we have costs really in this whole planning process, and the only way, forgive me my background in budgeting, but the only way you can ever set priorities is where you're putting the money, where you're putting your people, your time, your money, and we're not doing that here. We're not comparing HC7 to H3, HC29 or whatever. We're not comparing any of these things. There's no cost associated. And when first thing, when I looked through the plan 40, it's almost 400, it's not like 8 long. And I have to confess I didn't read it all. But I did scan through it all. This thing that kept going through my mind is how many billions of dollars it's going to cost over 20 years. Because there's no throttle on what we're suggesting. So how, without dollars, how are we going to cost out what Walter wants to do versus Steve versus John versus Emma or whatever? How are we going to do that without dollars?
Well, a lot of that we will depend on the expertise of these different parts. I can't tell you how much it really costs. I mean, I used to do on that. That's what we talked to the people that were transportation.
So can we ask the departments to estimate these in Region 4 or Arundel County for that matter?
So that's when we get to the goal policy strategy meetings later this year. That's when we present it to you. We're not only going to hopefully discuss the prioritizations, but we're also going to talk about performance measures. Every time I write those 2 words, I think you come up. So we're going to talk about performance measures, and that's something we definitely want to bring forward. You're absolutely correct. You can talk about putting a pedestrian bridge every mile along Richard Island. But is that feasible? Absolutely not. Not feasible. Not right now. And you're correct. We need to know how much these ideas cost, because completing a sidewalk is much more affordable than getting the metro from DC out, right? So we hear, and that's something we want to bring forward. Again, we don't want this plan. We want this plan to be something that everyone here in this room and everyone that's not here present tonight is proud of. And we're working together to figure out how to make that possible. if we need to go back to have a meeting with OOT and talk about financials, absolutely. That's something absolutely. On that note, since we're right at the time, Emma, go ahead.
Sorry, just very quickly. Just thinking, it seemed like from these presentations type specifically, all of them had things that they were, that they wanted to do so many more things, and they just weren't able to either budget or to lack of policy to implement it. So, two things I was just going to suggest are maybe like things like that, like the walking trail that was just mentioning that they can't do not allowing them to forward a walking trail. That's sort of a public health concern at this point, like, and so again, there's a county council, we can't stop that, but maybe the county submitting different policies to them that, I don't know, make it more of a requirement that if something is to do with public health, if something is to do with an equity concern, that they have, that maybe these departments have more of a latitude to make these calls. And then also having, I think, especially the things that my geriatric mental health expert, and my mom used to work at the baby medical center at memory clinic, so I know how far that is for the 45 time. And then for someone who's suffering from Alzheimer's or dementia or another illness, they have to have family with them taking them. So I think just also allowing one thing at the time budget or specific vision like that, how they want to build up. And those are things that people don't think about that they do their job. Sorry, I just think in general, we should run these departments a little bit more latitude to take the whole thing are they're admittedly more in touch with the community than.
That's what I was curious as to, they, and I thought they were great ideas. It's phenomenal. It's there. I mean, all those services on my account. But I don't know, I was curious as to what we can do to help push that along. And one thing that came up, clearly that the smaller assisted living places, and then that made me think, what are the brain spots called? Yeah. And I'm sure that that's probably a special exception variance or accounts or something to get them approved in the residential neighborhood.
I think they now, well, that's something that you want to look at, problem, but
well, and I don't know which way they wanted it, but is that something that would be appropriate in the plan to push policy to say, hey, you gotta lighten up on these things because they are going to be quiet and it is a consistent use. And yeah, the 6 people that are in there aren't, but so is that something that would be appropriate?
So yeah, absolutely. And the recommendations that we're hoping to craft for the region plan is going to have the scope of basically, I hate using these words, but growth and development. And I don't mean more people or more development. I'm just saying, when you think about growth, think about development, how can the region 4 plan affect? And that is a project that we need to use assisted living facilities. Because as we point out today, the elderly community, the elderly population is just, it's
156,000 divided by 2030.
So yeah, you're absolutely correct. So and this is one thing that we really, what have you experienced, right? Have you heard about when it comes to the development regulations? What are some issues? Have you heard of any issues with development regulations? What can be changed in code, or what can be recommended? Should ADUs be harder to obtain? Should be easier to obtain? Should assisted living facilities should their criteria to be constructed be different? That kind of stuff. It should be harder. Should be easier.
Or adequate public facilities cover. Hey, you want to put this density here, sidewalks, et cetera, et cetera.
I think that requirement of like up to there's like a tax happening for living lot, but maybe a requirement of okay, you aren't eligible to apply for this contract if you're not funded for the sidewalk.
ADA is already mandated throughout the country, right?
Yeah.
Well, then let's think of then striping equal to for the other thing we're going to see is electric bicycles. I think the people get it back. to some of those. And that's gonna open up the possibility of that, and as traffic gets worse and more horrible, people are gonna say, I'm gonna be on the school.
One thing to think about, small, places are really good, what happens is some, larger groups wanted to come in and take, remember, they have these larger houses, and they put them all, 4 or 5 of them, in a circle, just where they were, and make that a big difference. And the community is kind of like that. There's one house like the neighborhood.
Yeah.
It was a big, and so scale, how you make sure you don't do changes to the table.
The house is making all the
I don't know about.
I mean, that's a very good point. I think that's going to be something we talk about maybe next month. Enzo's potential design guidelines, design sections. They simply basically don't exist. And yeah, like assisted living facilities, very important. And if they're going to be part of the community, we need to work like that. I think very few times. I hope no times.
And getting 6 or 7 in a row, you see that, you get staff members. All of that is changing. You have already houses that are there, and people really not just right together. I think,
And then that goes back to the housing conversation we had months ago. You can talk about if you want to do more affordable housing, or if you want to increase density, how can you do it in a way that doesn't impact the overall character of the neighborhood, right? And yeah, so again, that's great. So we're past time, but I don't want to cut anybody's creativity off. So if you have any thoughts, write it down, send it to us. We will be sure to record it, and we are working diligently to get recommendations crafted to present to you by the end of the year. And really quickly, we just wanted to give you an update on the process. It's changed a little bit because if you remember correctly, this month was supposed to be the mixed use meeting. That's actually going to be next. Lorenzo's going to be heading that up in September. Now, in October, right now, we currently don't have a meeting. So I wanted to pass each of you guys a quick survey that will give your thoughts on something for the month of October. Is there a topic that you guys want to discuss more as a group? And this survey, if you guys do it in person, I really appreciate it, so I can have it in hand and we can kind of see where we're at, since we're about halfway of the SAC tonight. Everybody else that isn't here tonight, I will be sending a link tomorrow via email for you to fill this out. Essentially, it's just asking, is there a topic that you want to discuss more as a group, or topics? And then you can pick as many as you like, pick as few as you like, and we can go from there. We want to be able to provide you guys with opportunity to continue this group discussion. And I know some meetings have been better than others. I know some presentations have been better than others. But this is a way for us to kind of start thinking for the October meeting. And if we needed to reach out to different presenters or get more information for you, or if you guys just want to have a group discussion of just you 15 and see what you guys think. So if you guys can fill that out in the next minute or two, and get that back to me, that'd be great. One thing, again, September 26th is our next meeting. Currently I have this room reserved just to be safe. We're still trying to find a location up in the Pasadena area, just to be fair, but the Eastern District Police Station was booked. And I tried actually looking at the senior center, but staff leaves early. What? Mountain Laurel Library, that's in a shopping. They don't have any rooms. Right now, they're currently in a shopping center. Not for our group. Oh, they told me no, but I'll reach out again. And Riviera Beach, same thing, but hopefully the new Riviera Beach Library will be open by the end of the year, so we can start using that facility. Yeah. And then one thing to think about, and we can discuss this next month. We don't need an answer now. I just want to bring this up to your attention. The November meeting is the Monday after Thanksgiving. So that long weekend, I don't know if you guys are we're going to be wanting to get your SAC hats right back on after a long holiday weekend. Just kind of think about if we need to reschedule that meeting or not. That's all. And then we can discuss that next month as well. So that's all that I have. And again, thank you guys so much. And then I guess I'll give it to Ann so we can officially close it out. Or go ahead. No, Jesse had a. Yes. So yes, one other final thing, the walk and roll master plan is alive for public comments. So it would go to their project website, and I don't have that off the top of my head, but I can send that to you tomorrow in an email. Public comment is open. Feel free to address any issues or concerns or give them as much props as you see fit on their website. So. And then here, give to Ann.
Well, I think this was a very excellent session with so much information that was well presented. I'm very happy about that. I also thought the housing was really good the other time. If anybody doesn't have a question or last comment, I think we can ask for a motion to adjourn by second. All in favor? Opposed? Adjourned.
Thank you guys.
Those reports just actually full of all kinds of